Lymphatic system is composed of lymphatic tissue and lymph vessels. Lymphatic tissue is organized into diffuse and nodular lymphoid aggregations. The largest lymphoid aggregations are lymph nodes, spleen, tonsils, and thymus. Lymphatic system examples: lymph node examined by naked eye and eyepiece and low power. Spleen examined by naked eye and eyepiece and low power. Tonsils examined by eyepiece and low power. Thymus examined by low power, all stained with hematoxylin and eosin. By eyepiece, lymph node is kidney-shaped with dark blue peripheral cortex and paler central medulla. By low power, the stroma composed of thin capsule and thin trabeculae, extending from the deep surface of the capsule, dividing the cortex into compartments. The parenchyma is formed of outer dark cortex composed of lymph follicles and lymph sinuses, lymph follicles with pale germinal center, while the medulla is formed of anastomosing and branching lymphatic cores and lymphatic sinuses. The lymphatic cores are continuous with the cortical nodules. By eyepiece, lymph node is kidney-shaped with dark blue peripheral cortex and paler central medulla. By low power, the stroma composed of thin capsule and thin trabeculae, extending from the deep surface of the capsule, dividing the cortex into compartments. The parenchyma is formed of outer dark cortex composed of lymph follicles and lymph sinuses, lymph follicles with pale germinal center, while the medulla is formed of anastomosing and branching lymphatic cores and lymphatic sinuses. The lymphatic cores are continuous with the cortical nodules. Spleen. By eyepiece, the section resembles the shape of the spleen, with small blue follicles scattered in the section. By low power, the stroma is composed of thick capsule and thick trabeculae, extending from the deep surface of the capsule, dividing the spleen into irregular compartments. The parenchyma is formed of white pulp and red pulp. The white pulp is composed of diffuse and nodular lymphatic tissue, formed of scattered rounded or oval lymphatic nodules called Malpighian corpuscles, with non-clear germinal center but with well-developed eccentric arteriole. The red bulb is composed of diffuse lymphatic tissue, splenic cores, together with different blood cells and blood sinusoids. Tonsil. By eyepiece, the section resembles S shape, covered by stratified squamous epithelium. Deep invaginations of the epithelium into the tonsil form the tonsillar crypts that sometimes reach the base of the tonsil. A partial capsule on the basal surface separates the tonsil from the surrounding structures. By low power, stratified squamous epithelium covering the surface of the tonsil and lining the tonsillar crypt is seen. Lymph follicles are present underneath the epithelium around the tonsillar crypts. Some lymphocytes may penetrate the epithelium to mix with saliva, forming salivary corpuscles. Mucous glands formed of mucous acini are present deep to the follicles. Thymus. By low power, it is dark blue in color, formed of stroma composed of thin capsule and thin trabeculae, dividing the thymus into lobes and lobules. The parenchyma of each is composed of outer dark blue cortex formed mainly of lymphocytes, and inner paler medulla composed of few lymphocytes and numerous epithelial reticular cells together with acidophilic Hassall's corpuscles. Lymph node and spleen examined by low power stained with silver for demonstration of the reticular fibers of the stroma. The stroma is composed of capsule, trabeculae, and reticular fibers forming the background of the parenchyma. Lymph node stained with silver examined by low power for studying the structure of the stroma. Dark brown peripheral cortex formed of rounded nodules are seen with paler central medulla. The stroma is formed of capsule, trabeculae, and reticular stroma. All are stained dark brown. Spleen stained with silver examined by low power, showing dark brown stained stroma composed of capsule, trabeculae, and reticular stroma. Reticular stroma of Malpighian corpuscles are scattered in the section, and they have central arterioles.